Hello everyone, I'm Dr. Andrew Hall coming back to you from Hall Family Chiropractic in Danvers, Massachusetts. We're continuing our exercises to help support your chiropractic adjustment, to continue to heal your nervous system, and to continue to strengthen the muscles. This is part 2 of the exercises. We started off with the towel exercises or the spinal molding exercises. If you have completed that exercise, meaning that you can lay on those towels comfortably for 15 minutes, then you're ready for these exercises, which we call the Fulcrum Exercises, because in these you're still going to be laying on the towels, but those towels are going to act as fulcrums for your spine, so we continue strengthening the muscles, changing the ligaments, and help you improve your spinal curves. Now, the reason that we want to improve your spinal curves is because your spinal cord sits through there, and the better those curves are, the better your nervous system is going to behave, the stronger your body's going to be. These exercises are probably the favorite exercises of patients. They rave about these because they're going to help strengthen the muscles, but people love to do these exercises because you're mainly in an extension posture. We focus a lot on that because throughout life, driving in your car, sitting at the computer for work, we tend to be in these flexed forward postures, which are very, very damaging and dangerous to our bodies and to our nervous system. So these exercises focus on extension and strengthening our bodies to bring them back to these. So people love these exercises, they see great results, they do them all the time, and I'll encourage you to do them all the time. So I'm going to have Sarah come back. She is going to place the towels where you did for the towel exercises. So Sarah, come on back. And again, just to recap, the towels are supposed to be placed in very specific areas. As you can see, Sarah's placing that at about the midline area. If you feel your last rib, go about an inch above that. Ladies, for you, that's going to be right where your bra line is going to be. That's where the first towel is going to go. If you are putting it down here in your low back, that is too low, and you are doing it wrong. So do not do that. The second towel, and you can see it with Sarah right here, goes where the neck meets the shoulders. It should be low on that, not too high, because if it is, you're not getting the proper spinal curves on that. So Sarah looks great on both of those. So these exercises, there's really 3 for the neck and 3 for the low back. They're very simple. I want you to do 10 repetitions of each one. So you'll be doing 30 for the low back and 30 for the neck. So we're going to start with the low back with Sarah, and Sarah's already brought her knees up. So your feet are flat on the floor, the knees are bent. The first thing I want you to do is bring your left knee up towards your chest, grab a hold of that, hold it for the count of 3, then drop it back down. And let's do it with the right leg. Count of 3, 1, 2, 3, and drop it back down. That is the first exercise. It's very simple. If you can, the further you can bring your knee up to your chest, the better. Hold it for a count of 3, bring it back down. You will feel a lot of stretching, a lot of strengthening in the low back. Second exercise, put your feet and your knees together. Sarah, I want you to drop your knees off to the left-hand side. Good. Bring it back up, and then let the knees drop off to the right-hand side. Hold it there for about 3 seconds. Come on back up. That's the second exercise. You're rotating, you're moving the spine, which is great for stretching. It's great for the ligaments. Now, for some of you who find this really easy to do, even if the right is, say like you drop your knees off to the left, and the right hip comes up a little bit, that's okay, come on back. But for those of you who find this really easy, and I'll have Sarah demo this, when your knees drop to the left, I want you to turn your head to the right. And again, we get more twisting in the spine, which is a very positive, it's a very good twisting. So come back and do it opposite. So the knees go to the right, the head goes to the left. That's great. I would say everyone needs to work up to the point where they can do that comfortably. So again, 10 on each side with those. And then the final exercise is just a good old-fashioned crunch, where you're just going to bring the head and the shoulders and the low back up. So just, Sarah, go ahead and cross your arms over your shoulders and come on up. Perfect. Now Sarah did that great. Actually a little bit higher up off the towel, Sarah. There we go. Good. Now, because you have the towel in the low back, that's going to really take a lot of the abdominal muscles out of it. It'll isolate the muscles in the low back and work them a lot harder. Now, this is where everyone screws this exercise up, is because they think they're still doing crunches at the gym, so they do this and bring that neck forward. That is terrible for your neck and for your shoulders. So what I want you to think about is that there is a string attached to your forehead, and it is coming right up to the ceiling, so you're almost just lifting up. So Sarah, that's perfect. Good. and drop it back down. 10 of those, and you should be all set for that. Okay, so that was the low back. These are for the neck, and again, these are going to be very simple, and I want you to do 10 of these. So the first one is where you just push the back of your head into the floor or into the bed. Hold it, bring that chin forward. That's perfect, Sarah, and back. And you hold it for a count of 3. Again, with that pushing the head backwards, we're going into extension. It's strengthening the muscles of the neck. It's improving the cervical curve and changing the ligaments. So 10 of those. Next exercise. Sarah, I want you to turn your head to the left and look over your left shoulder as far as you comfortably can. Hold it for a count of 3, then back to center. Good. And then go to the right. And back. Very simple. That's the entire exercise right there. So 10 on either side. Very, very easy exercise to do, but that's going to improve the ranges of motion, especially with rotation, but also strengthen those neck muscles. And then the last one, and this one's a little bit tricky, where you're actually going to be bringing your head towards your ear. And this is the lateral flexion one, but because you're already in that extension lane on the towel, people think they can turn. It's not. So, Sarah, if you can bring your your left ear towards your shoulder. Perfect. Just like that. Hold it for 3, and then let's go to the right. A little bit of turning. I want you to think of the back of your head as a windshield wiper, and it's on the windshield, so it's just going to the left and to the right the entire time. Your head is in contact with either the floor or your bed or whatever you may be laying on at that time. So again, 10 of those on either side. That will continue to improve the neck muscles. It'll continue to improve the ligaments in that area, giving you more flexibility, strengthening the muscles so they'll be relaxed so you won't hold that tension as much. These exercises should be performed every night. Takes about anywhere from 4 to 5 minutes to do them. Do not rush through them, please, because if you're rushing through them, you're kind of just taking the point out of them. You know, on a commercial break while you're watching TV. Lay down, grab your towels, do these exercises, do half of them at a time if you want to. But consistency is key, so every night, 7 times a week should be the best time to do it. Thank you very much, and we'll see you soon. Good.